Hi, and welcome to Voices 21. Where we're here to share, learn, and inspire. My name is Jamila Ship. I'm the Managing Director of Capacity Building Services at Health Forum, and we're pleased to have you join us. We are here to talk about the social determinants of health in Asian American and Native Hawaiian and Pacific and Islanders communities. I would like to have Tracy and Maria join us, and we will continue to talk about this discussion as they've been working with our community partners, including doing community informant interviews.
Hi everyone, I'm Tracy Sun. I'm one of the community engagement managers at the Health Forum. It's great to be here.
And hi everyone, my name is Maria Gutierrez. I'm one of the program managers here at the Health Forum as well. Thank you so much, Tracy and Jamila, and everyone in the audience for taking the time to engage in this space with us today. We hope you enjoy this presentation as much as we've enjoyed engaging in these meaningful conversations. Next slide. Wonderful. So yeah, before we get into our findings, we felt it would be useful to briefly just review the social determinants of health and its definition in the context of the community. I'm sure many of you have had direct or indirect experience working with this theoretical framework. So I apologize in advance for the oversaturation, but the World Health Organization, defined it quite famously as the conditions in which people grow, live, work, and age, and the wider set of forces that shape the conditions of daily life. So in short, any extrinsic force or non-medical factor that has an influential weight on health outcomes. And so I encourage you to keep this definition in mind as we move along this presentation. Next slide, please. So to offer a little bit of context on the nature of this project, our team here at the Health Forum has been undergoing a series of key informant interviews. Over the last several weeks, Tracy, Jamila, and I have held 1 to 2 hour long conversations with a wide range of partners or Asian American, Native Hawaiian, and Pacific Islander identifying partners about what the social determinants of health means to them and their community. And so over the last 3 weeks, we've completed 11 rounds of interviews with executive directors, vice presidents, physicians, researchers, and subject matter experts from the Asian American, Native Hawaiian, and Pacific Islander community. And so we recruited partners from a variety of settings, including community health centers, regional nonprofits, and national organizations that are dedicated to improving the lives of their communities across the country. And our interview questions that we formulated were based on a racial equity framework model that we have been actively designing to help promote a more sustainable movement that addresses the social determinants of health in community-based practices. Next slide, please. Now, the justification for undergoing this process, however, can best be described, I feel, by the words of Dalai Lama, who said, "When we talk, we are only repeating what we already know, but if you listen, you might learn something new." So our team was particularly interested in understanding the ways in which the social determinants manifest at the local level, and more specifically, how it impacts the Asian American, Native Hawaiian, and Pacific Islander community. Our hope is essentially to employ these insights to develop more fruitful and representative community-centered interventions, technical assistance training, and capacity building resources that represent the true needs of APIAHF communities. And so with this presentation, we'd hope to share with you some of the insights we acquired from these incredible group of people. So the first question that we asked our partners was what they consider to be the most salient social determinant impacting their community's health. Next slide. So what was made relatively clear across the board was that there was an inequitable distribution of wealth, resources, and funding opportunities available for the AA and HPI population, which posits the notion that discrimination and health are produced and maintained at multiple levels. For instance, the scarcity of year grant opportunities, even more so for non-API organization or regions with a high concentration of immigrants, as well as the short supply of culturally competent, multilingual healthcare workers, has made it incredibly challenging for these organizations to serve, care for their community members in a meaningful way. And so, you know, this coupled with an increasing atmosphere of racism, discrimination, violence, tokenism, and cultural ignorance by community members, practitioners, and institutions has further perpetuated disparities and made these populations more vulnerable to poverty, food insecurity, homelessness, and diseases like diabetes and mental illness. And therefore, a lack of local representation and leadership and political influence has also kept these communities stagnant and unable to progress and stimulate reform over these systemic problems, and have further isolated and disenfranchised AA and HPI members, depriving them from the opportunity to thrive in, in spaces to grow and communities to live in. Next slide, please. So in the prior slide, we provided you with the aggregated findings from our thematic analysis, which offers us a macro level snapshot of some of the reciprocal influences at play. However, we felt there was an equally robust, if not more powerful, metric to portray these social determinants. And, that is directly from the source. The following statements I'll be reading are direct quotes from our conversations with partners. And these were some of the most notably raw responses. Quote 1, we definitely need to work more closely with our different communities, like the African American and Latinx community, so we can work together to address some of the systemic racism issues that exist in this country. Because sometimes when we're talking about a community working together, it's still not really working together. Health is and always has to be reciprocal. The social determinants of health won't work if we see it as charitable. I mean, yeah, we have to acknowledge power differentials, and for those in power to use it to eliminate those differentials. You want to keep the water flowing. You don't want it to be stagnant, the way we currently have now as a society, in which all the water is stagnant and being accumulated in part by a small group of people. So our job is to figure out what and where these blockages are coming from so that wealth can flow. And it doesn't necessarily have to be wealth in the form of money, but in the form of self. Next slide. Our area has predominantly stood as a vibrant immigrant community, but over time, apartment buildings started being torn down to build plazas and more expensive condos. So you're seeing more white communities coming in, and you're seeing more and more tokenism. Like, for example, the highway area is where all of these Asian restaurants are currently located. But what they don't realize is that housing in that space will start to push these locals out, and those communities are being pushed further and further, isolating families to certain districts where they can afford housing and where their kids can get an education. Next slide, please. I hope you enjoyed these initial findings and join me as we move along to the next question we asked our partners, which was, what kinds of ongoing challenges has made it difficult for you and your organization to support AA and HPI communities? Next slide. Now, the reason for posing this kind of question traditionally is to encourage a more granular dissection into some of these more or less concealed and endemic forces that continue to stifle AA and HPI communities. And as we move forward with these interviews, we determined these less perceivable barriers resembled much like the previous determinants, but in a much more structural manner. specifically as it pertains to inequities, community capacity, and organizational bandwidth. The first and most common barrier noted was a concern about the restrictiveness behind certain grant requirements, which often limit services to certain populations and leave organizations longing for financial sustainability. The second commonly reported barrier that was echoed by many of our partners was this community-wide sentiment regarding the acquisition of cultural gatekeepers, the recruitment and retention of trauma-informed healthcare providers, and the increasing necessity to create more sustainable partnerships across agencies, sectors, and minority groups. And these prevailing challenges were not isolated in nature. They were often catalyzed by other coexisting problems, including power imbalances within sectors, underrepresentation in data, generalization of people, and fearing the loss of one's culture, language, and identity, fearing a loss of funding, resources, credibility, and support, and fearing the loss of sovereignty, land, and legal status. Next slide, please. Here are some of the corresponding quotes that further amplify these challenges. So I think the challenge is always coming from funding, right? I see a lot of support to help communities, but they always forget about Asians, right? When federal agencies send data, they always send data on the African American and Latino community, but for some reason, Asians don't exist. Affordable housing has gotten to the point of absurdity. Most of my employees are dealing with it on a daily basis. I don't know how we will be able to withstand this as an organization in 5 years. Slide. Unfortunately, priorities have been given based on funding availability. Like, for example, this is not at the highest level priority, but HIV prevention work hasn't been funded for just API communities anymore. And so a lot of API serving agencies that focus on HIV work have had to pivot their focus to survive. It's usually the funding or access to funding that lets us know what services we can prioritize, because that's what we can give. So it's hard to opt out of what grants dictate, unfortunately. Health outcomes and life expectancy measures are based on a Western model framework. So why would we think any different in terms of the systems that are in place? It's all based off their lens, their perspective. They crafted these policies and health outcomes based on their lived experience. So I mean, you'll see it all the way around, systemically. That's why we're not doing so great, because all of it is being based off of them. That's the standard. So the question now is, how do we implement policies that are more inclusive of a wider range of people that are not white men? Next slide, please. So the last question we're going to cover today that we asked our partners, which was what helpful services, capacity building assistance, and or technical assistance do you feel would help alleviate these social determinants and address health equity for AA and HPI communities in a sustainable way? Next slide. Now, for this question, we were really seeking to absorb as much insight and on-the-ground perspective and specialized knowledge about what AA and HPI serving communities need to sustain their efforts and promote health equity in a sustainable way. And so I think it's reasonable to acknowledge that, addressing some of these more systemic changes that we've highlighted earlier will take time. But if in the meantime, we could at least ensure that the resources being disseminated are more representative of the times we're living in, the people we're serving, and the political climate we've inherited, there's an opportunity for us as an organization and others like us to continue to fortify these local systems from within to promote sustainability, develop capacity, and further amplify the voices of this collective community. And so what these conversations revealed to us was that aside from the well-known necessities like funding, staff, and training, there was a dire need for a disaggregation in not just data, but in services rendered, particularly for Native Hawaiian and Pacific Islander serving communities. Also, the type of assistance mattered just as, or in certain circumstances, more than the amount of resources provided. For example, many of the existing grant management training resources did not yield enough information for them to comfortably operate these administrative functions and navigate some of these more common gray areas independently. Automated, pre-recorded services were in no way as impactful as direct one-on-one assistance from experts. So in other words, the modality in which these training services and technical assistances were rendered had a significant influence on how well these organizations retained the knowledge and correspondingly responded to these challenges in the future. So this in conjunction, with the acknowledgement that one size fits all approach doesn't and will likely never work in practice. Next slide. And so finally, here is what our partners had to say about this matter. For us as an agency, we need to be more vocal about what policies we support, because being in silence doesn't help us. Like, they're not going to know what issues we face if we remain silent and then speak out only when there's a major issue, like, oh, it's time to vote, or, this bill is being addressed, Like, okay, well, then what are we going to do? Our focus efforts in the past have been on voter engagement and civic engagement, but in terms of policy reform and advocacy, we don't have the infrastructure. That's something that we're trying to build. But to be honest, over the years, we've been very conservative about what we say out loud because there's fear of what the federal government's response will be, and not knowing if what we say is going to have an effect on our grants. Next slide, please. I think maybe understanding how other agencies have successfully implemented best practices for some of the issues that we're facing. Because again, being in the Southern region, we're kind of stuck creating our own model. It's hard to mimic strategies that are based on places like California or New York. Like, the needs and sometimes even the barriers we actually face are quite different. There's not a lot of agencies our size that serve this kind of community. So it's almost as if we operate in a bit of a silo within a silo. Next slide, please. We need to have different tracks of CBO trainings, like one for established CBOs that have like deep pockets, and ones for smaller and less established organizations. They need to understand that there's different levels to different types of organizations. Sometimes the ability to implement something looks very different based off of how you set up that local infrastructure, along with all these other things, because like these CBO grant management trainings, they're so complicated and technical. I'm like, you're going way over my head. Sure, yeah, we have our 501c3 status, but no, we don't have like a bookkeeper. I know I have to go get one. I know I have to go get like a payroll service, and all these different things, but it's like, they want to award you with these grants, but they don't want to help you with the technical assistance. They really need to start asking themselves like, oh, what does the CBO need in order to expedite all these services and programs? So I'm going to hand it over to Tracy now, who's going to just provide a summary of some of the key takeaways from these interviews. Take it away.
Thanks, Maria. I just want to say that Maria and Jamila and I were really struck by the candor display during our key informant interviews. I think our participants really appreciated being able to sit down with us and just have an open, honest conversation, which can often also be therapeutic at times. So we just really appreciate the opportunity and their trust in us. We can't go over everything we spoke about, so I'm going to go over some common themes that came up during these interviews. And they're just really helpful reminders for us, at least, as we move forward, not only with our programming, but also how we continue to build and strengthen relationships with our community partners. We want to let them know that we see them and we want to be better partners for them. So first, a major theme we encountered was the limitation of existing grant and funding structures. First, there's always a limited amount of funding available, especially for ANHPI orgs and especially for NHPI orgs. We're not included in health equity conversations a lot of the time, and the lack of data disaggregation makes it seem like inequities don't exist in our communities and within our communities. And the kinds of available funding also dictate what kinds of programming can be made possible by CBOs and clinics. Many of these times, grants are created with short cycles that don't emphasize sustainability or maintaining kind of a community-based infrastructure for the future. Even though these organizations are really the trusted leaders and messengers in their communities, they really know what's going on and they're experts in the field. And finally, as Maria mentioned, grant management can be an onerous task, and a lot of times organizations barely have the capacity to track and report different performance measures required by different funding institutions. And furthermore, sometimes the things they're asked to capture don't even necessarily represent all the work they do. Like social media impressions and engagements can only tell some of the story. Also, we found that organizations we interviewed wanted to strengthen their advocacy and policy-driven capabilities. However, some feared about rocking the boat, especially with grant limitations on what kind of advocacy work they can do. So they want to play it safe. And as I mentioned before, funding's already limited, so they don't want to jeopardize that. And I think this can be frustrating because some policies, like on immigration and Medicaid expansion, infrastructure, et cetera, they deeply affect the communities these organizations serve, and they want to help. I also think a lot of organizations kind of struggle with their identity and what they want to represent and what they want to stand for. And part of this is, of course, established with the founding of an organization and the leadership. But I also think it's important for employees to kind of have a sense of the bigger picture. Oftentimes, we focus on everyday tasks and program management, but it's important to step back and look at why it's important. And capacity, of course, is just a huge issue. Any help with streamlining operations is valued. And this goes back to funding structures and genuine investment with community-based organizations and clinics, because it's hard to hire people for just like short grant cycles. And also staff can get burnt out because they're taking more workload because they're short-staffed. And a lot of these organizations also rely on volunteers, so their time and energy is limited. So again, there's value in taking a step back and just looking at the bigger picture and making time for kind of pulse checks, like what is our role in creating health equity for AA or NHPI communities, or even just attempting to kind of break down these complex policy issues into something digestible. It's valuable to keep a good gauge in that realm. I think people can feel siloed, and doing our work sometimes it's nice to know where you fit into that puzzle. And I think the bit about honest conversations really leads to the point about forming purposeful connections and collaborations with other community groups in order to drive real progress. Needless to say, the AA and HPI community is so diverse. So when we're working together, it's always a balance between honoring each culture and identity, but also finding commonalities and ways to meaningfully collaborate and learn from one another. People just don't want to feel like they're checking a box. And I think our NHPI community orgs don't want to feel that way, especially. And I think there are a lot of efforts made to educate the public about disparities we face and fighting for a seat at the table, but there also needs to be education amongst us as well. And I think these interviews are just one step in creating a space and platform to share feedback. And we probably have more questions than answers right now. But thank you for listening to our initial findings. And again, this is just one of many conversations we'll be having with our partners. Feel free to comment with any questions or feedback on the live stream through YouTube and Facebook. And now I'm going to turn it over to Duncan Hwang, who is going to talk a little bit more about the groundwork in addressing social determinants of health we referenced earlier. So please take it away.
Hi, everyone. My name is Duncan Hwang. I'm the interim co-ED at APANO, Asian Pacific American Network of Oregon. We're based in Portland, and I use he and his pronouns. And gosh, like all those findings really struck a chord with me. I just like identified so much with them. And in my slides, I kind of talk about our work kind of on a local level and how we've been working to advance the social determinants of health, and also how some of these findings really kind of played out on the ground. So let's see, how do I start? Oh, here we go. Okay, thanks. So just a bit about our organization. I think like many folks in the audience, we're a culturally specific organization. We do community organizing, civic engagement and policy advocacy, leadership development. We have a pretty robust cultural work program, and we do community development work as well. And over the last, year and a half, 2 years, like many folks, we've also done a lot of COVID-19 response work. So meeting immediate needs with like rental assistance or food security, and also holding our own culturally specific vaccine clinics. And we also have a pretty strong focus on place-based initiatives. And our goals in our place-based work, especially in East Portland, is to build community power and self-determination to prevent involuntary displacement and to improve public health outcomes. So we do our place-based work in the Jade District, which is in East Portland, and then on the west side in Washington County, and kind of like the Beaverton, Hillsborough area of Oregon, if you're familiar with those. We also have a sister organization, just APANO, and we do political work as well. So our C4 staff do all our lobbying and political endorsements and that type of work. So we closely coordinate both on the systemic change and policy level, and then organizing, and then like on the ground building stuff. Next slide, please. So yeah, so just a bit of introduction kind of on our place-based work of where we are. So, we're located in the Jade District in East Portland. It's home to about a quarter of Portland's API community. It's lower income compared to the rest of the city, and 71% of the API households here are of limited English proficiency. So it's actually one of the diverse neighborhoods in the whole state of Oregon. Next slide, please. So we take a really holistic approach to community development and, working on the social determinants of health. So we work on our built environment and the physical environment. We are working towards, building parks and green spaces, quality, affordable housing, and really focusing on interventions that improve our air and water quality. We also work on the social and environmental level. We do starting to do workforce development, and doing some parent organizing to improve access to culturally competent education, and things like dual language immersion programs for Chinese and Vietnamese, and also working on a lot of childcare policy, which has been really interesting, and I think a kind of a big national trend. So just working on a lot of different levels to improve community health. There's no like one magic bullet that addresses anything. I think it all has to be done in combination. Next slide, please. So on this slide, I'm going to focus on, or in this presentation, I'm going to focus on two of our big areas, so of the social determinants of health. So the first one being housing, and the second one being transportation. So before the pandemic, we were seeing annual increases of rent of about 14 to 15% annually. And that, is putting a lot of pressure on our communities to be able to stay in place. So, we've been working on the policy level on, different changes to zoning, different tenant protections, and then just building more affordable housing, and really kind of cultivating kind of the social capital of our community to really be able to address shared challenges like rising rents. Next slide, please. And then on the transportation front, I think I'll have a slide later, but we're basically located between two state highways. So, it's a classic kind of environmental justice concern area. And I was kind of struck by one of the earlier findings of the Asian American owned restaurants along the highway. That's kind of exactly what our neighborhood is. And, one of our projects over the last, 6-7 years was actually working on a new transit line that ran through the neighborhood. So it can connect downtown Gresham with downtown Portland, and we were able to negotiate a community benefit agreement, and all these other kind of workforce development goals and support for local businesses to really kind of protect our community as this transit project was being built. There's a little funny picture of me there. I'm accepting this like $87 million novelty check from the Federal Transportation Administration on behalf of the community for this transit project. So next slide, please. Yeah, so like I mentioned, we're located kind of in this like urban area that's like at the intersection of kind of suburban Portland and urban Portland. To our east, we're on 82nd Avenue, which is a state highway, and then to the west. And to the east is I-205, which is another state highway. And then to the north, there's these two high crash corridors that were kind of boxed in our neighborhood. So it's a classic environmental concern area. We've had a lot of pedestrian fatalities, unfortunately, over the last couple years. We have public health concerns in terms of increased asthma and cancer rates and lower birth rates. And we're also seeing a lot of development. So we're seeing, the rising property costs and unemployment, as well as a lot of businesses closing because of a fallout of COVID. And we're seeing this chronic underinvestment in infrastructure, which is leading to all these, dangerous conditions. So, there's a lot of aspects of the social determinants of health that we're hoping to address. So housing and transportation are major concerns, and then also kind of the strategies that we want to invest in to address them, like community organizing and advocacy. So yeah, our second strategy, the first strategy we were focusing on was like really the built environment. So how do we, build more affordable housing? How do we build transit lines? How do we build parks and green space? The second strategy is really around organizing and empowering communities to advocate for themselves. So we do things like, tenant organizing, community organizing. We have a formal leadership development program for neighborhood residents. And then we do a bunch of like cultural work and creative placemaking. We're also exploring this service to advocacy kind of model. So we have complementary like services to meet immediate needs. So we have, workers relief fund for folks that were laid off during the pandemic. We do workforce development, food security, rental assistance, and small business advising. So the ultimate goal is really to take, folks that come in need or, as clients, and then move them into thinking about kind of systemic issues. And, that's not for everyone, but, for every, couple of folks that come in, some people are really interested in addressing kind of root causes and doing, more organizing and advocacy. So that's really kind of the strategies that we're thinking about a lot more. Next slide, please. We've also invested a lot in creative placemaking. And, I think a lot of that is, how do we engage community members that, are maybe, younger or don't engage traditionally in public planning processes, like through like online surveys or, dot exercises. Like I think we're really using, arts and culture to highlight, community strengths, bring in new voices, and to really kind of draw attention to some of the challenges that we want to address. So we have a formal kind of placemaking program where we do, re-grants. We have a curriculum that artists go through, and then as well as an advisory body of like, more professional like artists to serve as mentors. Next slide, please. So the art work that we do and cultural work is, done with a purpose. It's not just art for art's sake, but, it's really focused on bringing attention to community needs. So these are like all different, sponsored art projects around, creating an exhibit on displacement or kind of the history of a neighborhood, or highlighting kind of like what stood here at this affordable housing development before it was affordable housing. So a lot of kind of those stories are being teased out, and it's to build awareness and community. Next slide, please. So yeah, when we were working on the transit project, it was actually had a different iteration and a different line, but like because of the cultural and placemaking work, we were actually to influence how the line ended up being constructed. And it was through a lot of storytelling. Like these restaurant owners have been here for 70 some years, and they would have lost their business to construction. And through kind of telling their story, we were actually able to partially divert some of the stations and things like that to keep the neighborhood more intact. So I think that really speaks to the power of organizing and arts and culture work. Next slide. Yeah, we also spent a lot of time just creating exhibits to remember our past. The neighborhood that we're in, was farmland about 100 years ago, and then a number of Japanese American communities, family members, owned a lot of the property here, and then lost their land during the internment here in Oregon and never got it back. So there's just a lot of history to tell about, the land being stolen, both from the indigenous community, but also more recently from Japanese American communities. So it's part of our historical legacy that, we want to keep on top of our minds. Next slide. Yeah, and these are some examples of the reclaimed space that we have. There was a visioning process, and we really wanted to see a lot of the old infrastructure kind of reclaimed to be made into parklets, and to have art on them to encourage folks to be safe and slow down traffic and things like that. So there's a lot of like art installations all around the neighborhood. We also have a night market every year that brings tens of thousands of people, and really creates positive stories for this underinvested neighborhood, and also is a really great economic development tool for micro entrepreneurs. A lot of them get their start and then move on to storefronts and things like that from the night market. Okay, next slide. Just want to spend a few minutes on how we've been able to partner with CDCs and other housing providers to bring a lot of housing to the neighborhood. This is actually where I'm at now on the picture here. This is our mixed use development. So we have 48 units of affordable housing on top, and then we have a ground floor community center in our APANO offices. So that was a project completed in 2019, so relatively recently. Next slide, please. So through kind of our organizing and in light of the transit project, we were able to negotiate a community benefit agreement, which included 300 to 600 units of housing, a small business mitigation fund, and kind of the service hours that were saved from this transit line were reinvested in other kind of community serving routes. So I thought that was a really interesting kind of meshing of organizing and on the ground development. So when we do projects like transit lines, they're not just transit lines, they're entire community development projects that can serve to uplift the whole community. Next slide, please. Let's see. So yeah, I mean, we've also been doing a lot of just on the ground organizing and tenant organizing. So, convincing folks that are experiencing rental increases to kind of engage with us and legal aid to, basically halt illegal rent increases. and then also for us to buy time to build more affordable housing. So a lot of folks that are living in market rate housing that's like, subpar or getting too expensive are been able to move into affordable housing that us and our partners have been developing. Next slide, please. We also do parent organizing, and we originally started as kind of an education group where folks wanted to advocate for different dual language immersion programs or better, curriculum at the school district, but the parents actually just really wanted to work on housing. They kind of organized themselves and went to City Hall and was able to win some more tenant protections and affordable housing for the neighborhood. Next slide. And finally, like I mentioned before, we have a leadership development program, and that's really focused on, I think when you do like base level community engagement, you hear things like the rent is too damn high. But I think the next step then is really like, how do you go from basic like input, like the rent's too high or the streets, are too dangerous, to being able to advocate for specific action items like in the city or county budget, like spend more money on this, and this is how you pay for it. And these are the pots of funding that you want to pull from. So that's the kind of the intent of our leadership development, is to connect technical knowledge and subject matter expertise with community. I think I'm about to wrap up, so I think I have just one more slide. Let's just skip these. Sorry, I'm a little long. I think the last bonus strategy is just, we have a C4 organization, and we really invest in political engagement as well. So 2 years ago, we were actually able to recruit and elect one of our former staff to represent the J District in the House, in the Oregon House, and that's just made a huge difference in, being able to win kind of the community investments that the neighborhood and the community needs. So yeah, those are kind of the 4 strategies that I wanted to highlight to advance the social determinants of health. So thanks for having me, and I'll pass it on to Jamila.
That wonderful presentation, and thank you for Maria and Tracy for giving some context and some insight into social determinants that are affecting our community. And we're concluding this presentation, but please feel free to reach out to us to continue this conversation and continue to see you. We'll see you throughout the conference. Bye.